Hello, this is Dr. Anthony Chang from AI Med. I'm here with a special guest, Dr. Tony Young, who will be part of our faculty for the October 30th AI Med UK event. So welcome, Tony.
Thanks for inviting me to join you this afternoon. I'm not quite sure what time it is where you are.
It's about 6 in the morning, but
You're looking very good for 6 in the morning.
Thank you. I've been up for a couple of hours. So, Tony, wish I could give you a hug right now, but it's been a long time. But it looks like we're going to be in this for a while. So I'm a huge fan of your clinical entrepreneurship program. Personally witnessed one of your pitch events, and wish we had it here in the U.S. So how, between the pandemic and the escalating progress of your program, tell us what's going on in the AI world vis-a-vis your program.
Thanks, Nancy. And I tell you, I think at the moment in healthcare, everyone could do with a great big hug. I'm still a clinician on the front line, you know, being on the COVID with respiratory wards, even though I'm a urologist, people still get urological problems. I never expected to dress up in a spacesuit and go and deliver healthcare, and it's hard and it's pretty shocking for everyone. And you know, I suppose that's one of the things I like about AI so much, because it gives us some hope, doesn't it, for the future, that we can help make things better. And that's one of the most, I think that's one of the most beautiful things about it, really, isn't it? Which is kind of a summation of human knowledge and bringing together the latest medical advances and the latest in technological advances and programming and yeah.
It's a very bright North Star, and it's kind of a misnomer, right? There's nothing artificial about this intelligence. It's a human-made intelligence for machines. No. And you and I have something in common. We hang out with young people all the time.
Well, I was going to say there's a couple of things we hang from. Not only do I hang out with our entrepreneurs, I also, you might be able to see it on the shelf behind me, have a great new piece of reading called Intelligence-Based Medicine that someone kindly sent me that I'm working my way through. So there we are. I get to meet you.
It's a mere 518 pages. You'll go through it very quickly. No, I think it was a tribute to the field and where it might be headed. And I think, you know, coming back to young people, probably one of the most heartwarming moments is that, as you know, we have an annual summer internship program, and we also espouse principles of not just AI, but also entrepreneurship. And we had to go entirely virtual this summer. And I've had some really amazing times with them virtually. And they've said that they feel stronger about going to medicine than ever before as a group because of the pandemic. And that really, really was very heartwarming. So I think the future is in good hands based on what you and I are experiencing. To give us some examples and stories about your program and vis-a-vis the AI domain.
Yeah, sure. So I think, so the program has been going really well. We've just finished year 4 and are now recruiting for year 5. And actually, in the middle of a pandemic, we've never had so many applications, over 700 applications on our system. We've just closed the application portal. So up to year 4, we'd had just over 500 clinicians on the program with 226 startups. And I'd say at least 10, maybe 15% have an AI element involved in those startups. Whereas in year 1, when we started the program in 2016, perhaps there were 1 or 2 on the program at that stage. So now we're starting to see that come through. I haven't even started to look at the stack of applications I've got to go through for this year, but really interesting that in a really tough time in the middle of a pandemic, that actually clinicians are stepping forward with more entrepreneurial ideas, not less ones.
Right.
So I agree with what you were saying about the engagement you've had from your fellows, in that people are really going, how can I make a difference? How can I contribute? And so that's been an incredible experience and a kind of a I suppose, a stamp of approval that maybe we are doing the right thing and providing an opportunity for. I mean, it's the future. I mean, I'm sorry to say this, Anthony. You and I, we've probably passed our peak of our input, and we've got to get these young ones coming up who are the superstars of the future, and we can guide them, we give them blessing and help in their way forward. And you know, we're seeing lots of in AI in the startups that are coming through in our program. What we're doing, we're seeing a range of different things, from people using the analytics in sort of back of office kind of services around that. So one of our startups is doing a kind of an AI blockchain for medical authentication, so a real human resource function, and that's going really well at the moment. Number of people using it in the med ed space. Someone creating or having a go at creating the first AI med school. So can we not just have AI-powered chatbots and not just clinicians, but also patients giving their stories and experiences? But could we have a bigger ambition than that and grow that out into, why can't you have a virtual medical school? Why do we still have to go in and do those things? Well, I think you always still have to see patients, but actually there's something around, there's something in that. And then lots of people using AI in, you know, to enhance things we're doing. So some of them are mentors on our program and are helping our young entrepreneurs go forward. So the guys at Odin Medical have created this, and they actually won one of the, I think, stage 2 awards in the NHSX AI lab announcement that was made a month or so ago now, and that's around computer vision in combining that with colonoscopy. So develop, you know, 20%, I think it is, of flat polyps in large scale audits are missed on first colonoscopy. So that opportunity to diagnose bowel cancer at an early stage and treat it, 20% of the time we're not getting there. And this AI technology is transforming that. So you're picking up 99% or more of cases straight away. And we fast tracked that through on this program. But there are a number of, so it's a mixture of different things, I think. Back of office, med ed, some directly clinical facing things. The ones that are coming forward more quickly, and we're starting to see, are the things that don't need the clinical trials and the validation. You know, lots of things, of course, going on in radiology and other spaces too. But interestingly, the where we're seeing it go quicker, I think, in radiology is around clinical trials. And actually, there's a new entrepreneur started on the program that's doing something around using an AI system for identifying people who would be suitable based on their radiology results for inclusion into clinical trials, and then automatically inviting them to if they'd like to take part. So ways that I hadn't really thought AI might be used to start with. So, but
well, I'm seeing. Well, I was just going to add, Tony, that I'm the privileged editor-in-chief of the New Journal with the same title as the book, Intelligence-Based Medicine. And what I'm saying is the clinicians are more involved than ever before with the data scientists on coming up with some really incredible ideas for projects, and not just looking at chest x-rays or CTs in COVID and trying to differentiate that with a normal chest x-ray. As you know, that's limited utility, but actually doing amazing projects, looking at drug repurposing, looking at knowledge curation to bring to the front line. And I think the kinds of projects that only a collaboration between clinicians, even young clinicians, and data scientists can bring forth, right? So I think this pandemic has been an amazing clarion call for everyone to get involved in this domain and take advantage of this amazing resource that's ahead of schedule.
So I agree with you, and I'd say one of the things that we have seen it do in England, I can't comment on what's happened in America, is before there were quite a lot of barriers up to collaboration between different organizations, or whether it's bits of the healthcare service or government or industry. And, you know, people have just been suspending that. They've been rolling their sleeves up and actually collaborating on a major scale. And so we have to get on with this. We have to do it.
Yeah.
We'll ask for permission later if there's, a problem with that. And guess what? There's been no problem.
Yeah, yeah.
And
We're seeing the same.
Yeah.
We're seeing the same here, Tony, that traditional barriers, even amongst elite academic centers, have been lifted. And I think it's humans versus the virus, right? So as I say, it took a pandemic to push this innovation and intelligence paradigm, and I think we need to, because otherwise the viruses continue to have an upper hand.
One of the things we've seen, particularly in the National Health Service, is because we can share our data sets, particularly around research, right across the nation. So before, one of the big issues, of course, was how are we going to share data sets to get the benefit of those, and bringing those together and the answers we might get. Well, in this pandemic, whether you were down in Truro, which is down in Cornwall, or up in Tyneside, up the opposite end of the country in Newcastle, we've been entering data from intensive care patients with COVID. And that's how we were able to disprove some of the medications people were putting forward, and actually prove very simple things like dexamethasone, and to such a high level in clinical trials. So I think it's kind of unearthed this thing at actually pooling and sharing data can be really helpful when it comes to an emergency. And just imagine if we did that more, what could we do? And does that data sharing that we're now starting to do to help with the pandemic, is that going to help us to gain more acceptance with our patients, with the public, with professionals, academics, institutions, to say, imagine if we pooled those data sets and then utilized the power of AI to give us those insights, those answers. I mean, and how many lives will the dexamethasone, a really cheap drug, have saved across our planet in this pandemic? And it came out of shared data sets in the NHS. Just imagine if we collaborated and connected data sets across the world, what we could uncover.
Well, it may just make some randomized controlled trials obsolete, right? If you think about it. So I think the future is amazing. So thinking about the future, Tony, let's you and I think about 10 years from now. Hopefully after the pandemic, although there could be another smart virus right around the corner, as I say, that's even more lethal. So we'll have to bring our A game. What do you see 10 years from now for AI?
Oh, what a great question. Well, I mean, firstly, on the pandemic, one of the beauties of my role at NHS England is we get to see lots of our national data sets quite early on. And I think it's so unpredictable where we will be just a few months down the line. So you've gone, hey, I'm going to ask him an even more difficult question, which is 10 years down the line. So you're kind of setting me up for a fall. But I think there was lots of, 5 years ago, 6 years ago, when people were starting to talk about this, and companies were starting to make offerings and come and see me at NHS England around this. There was, AI seemed to be something that was going to do everything. And I think the realization is it's not going to be able to do everything. It's certainly not going to replace human beings. And I think we saw something similar around sort of keyhole surgery and robotic surgery, didn't we? We were going to go from this big open operations that required long hospital stays, and suddenly everyone was going to have keyhole, and it was going to revolutionize things. Well, lots of people have keyhole surgery, but there's still a place for traditional open surgery. And it didn't take 10 years, it took 20 or 30 years for that kind of change to work. And that was just moving from big cuts to small holes. And whereas AI is a revolution beyond that. So I think the horizons might need to be a bit longer than 10 years to get the significant change. I mean, you look at genomics. Again, 1950s, DNA was discovered. It wasn't until, another 45, 50 odd years before we decoded it. And here we are 20 years after the decoding of it. and we're just starting to make those major inroads into, whole genome sequencing for cancer, for treatments and things like that. So I don't think people should push AI too much and expect something from it tomorrow. If I had to say where I'm seeing it and make its greatest impact in healthcare, initially it's in things that sit behind the scenes, more helping us better manage and organize our systems and processes and delivering healthcare. Things really interesting things like, digital surgery or touch surgery, some people may know it as, was brought out by Medtronic in February time earlier this year. And they've got some really interesting things they're developing around using computer vision and AI systems in looking at the whole operating theatre. So not just the operation that's going on inside the abdomen, but actually the people who are in the operating theatre suite, how are they moving? What are they doing? What's efficient? What's not efficient? What leads to better patient outcomes? And of course, a human being could never analyze that, but a computer vision AI system can capture that and explore the features of good operating teams, good operating theatre processes, how you can most effectively deploy the resources you can. So I would think technologies like that are going to have more and more impact over helping us. We're never going to get rid of the human being. I really don't think that at all, but helping us know what good is and why it's good and what we can learn from that, whether it's in organizing the logistics and supplies for your hospital or the human resources or the way your operating theatre and department might work. I think those will come forward more frequently. There are lots of things, as you know, and have seen many of them, of things that are augmenting our ability. So kind of making humans superhuman in a way. And things like, again, looking at things like computer vision in, I think we were talking earlier about colonoscopy, and actually how can you spot and mark those polyps rather than relying on human memory. So those things I can see coming forward. Of course, there are the grand challenges and visions of truly what the future might be. But I've now been qualified I'm practicing for 26 years as a physician, and I kind of look at it and go, well, what's different now? What has happened now compared to 26 years ago? And actually, there are some small changes. Keyhole surgery is coming, robotic surgery is coming, clearly, but actually lots of the practice, particularly in surgery, lots of the practice is very similar. And, our forefathers have been practicing for a long time. But could we be coming to a tipping point where AI really helps us unlock things? I think we could. I think we could see some of those things we do and take as a routine. It's just part of what we do. I could see it replacing that. And could 10 years be a time frame for it? Why not? But you're asking me. You're the thought leader in this space.
No, I agree with what you're saying, which is I think within a decade, we're going to start having AI be more and more embedded into medicine. And we're not going to make such a big deal out of it any longer because it'll just be routine practice. And I do agree with you, Tony, that a lot of this is going to be behind the scenes in the form of machine learning, robotic process automation. There's so much in healthcare that needs the burden that needs to be mitigated. So, and I think 10 to 20 years from now, we'll look back on this talk and say, gosh, Tony, can you believe that we were thinking of AI just to have workflow improved? and then there are all these things now in terms of drug discovery and design for vaccines that's going to be around. And do you remember COVID 2019? Can you believe how much we suffered through that? So I'm predicting.
So you said, I am going to make one prediction, and I'm prepared. I don't know what wager you're prepared to have on this. Maybe I'll buy you dinner if I'm right, and maybe you'll buy me dinner if I'm wrong. But this weekend, Number 10 put out a press release on Saturday morning around one of our clinical entrepreneurs. And they have set up a drone startup to do autonomous drone logistics, creating a national air grid between hospitals across the United Kingdom. Initially, it's going to be allowing for delivering PPE and test kits for COVID-relating things. Now, initially, the trials are going to be under direct line of sight through human-controlled air corridors, but the plan is that this will be an autonomous system empowered and enhanced by AI, so that actually you've got these wonderful so these fixed-wing electric drones can fly 60 miles in all weather conditions. They've got vertical takeoff and landing. Just imagine if you needed something in your operating room and you didn't have it, and actually it could be flown to you within 30 minutes of where it is. So something very simple that, well, it seems simple, logistics and delivery, but actually drones haven't come forward. They've been around for a long time now, but they haven't quite broken through that threshold. Could an AI system that help, because once you're out of line of sight, you know, then you need something to control them and
Yes.
predict what's going to happen and look at patterns and what's going on. So I will make one prediction for 10 years. I could see autonomous drone logistics, certainly in the NHS and healthcare. And if it hasn't happened, I'm going to be really disappointed. And
have to pay for dinner. And have to pay
for dinner too. So there we are. But
that's a dinner I would be happy to pay for, because I think this pandemic has taught me that you need the 3 I's: innovation, intelligence, that being machine intelligence, as well as human intelligence, but also imagination. You know, we have to imagine a future that isn't here yet, and we have to hold the humans accountable for that future as well, not just expect it to show up past, you know, and we can't sit passive. So, and famous people like even Da Vinci has said that you have to move things forward. You have to work for the future. It doesn't just show up at your doorstep.
Yeah, but I think when Da Vinci first drew a helicopter, I think it might have been 350 years till they pitched up with a real one. I hope it'll be a bit quicker than that.
By the way, he was also the first to think of a computational machine, even before Alan Turing. So, so anyway, with that, Tony, it's been such a pleasure. Really missing you in person in the UK, and I miss the UK also. So we hope to see you in the near future, and we'll be welcoming you to the October 30th UK event. So thank you so much, Tony.
Thanks.
Be safe.
Great to see you.
Likewise.